everyone, today I want to talk about a case again, and this case them is similar with another case I ever talk about. This is study case 17 I talk, and this them is about informed consent but with another story, with another case. So before I start to talk about this case, I want to remind you about what is the informed consent. Every medical treatment requires the patient. Every medical treatment requires the patient informed consent. The significance of this consent is that a person agrees to the treatment, the invasion of his body, understand the significance of his medical condition, and the meaning of the treatment, the danger and the benefit inherent in the treatment, and grant his informed consent willingly and without coercion. In order to obtaining an informed decision, there are three elements must be determined. Number 1, free will. The patient wishes without coercion or outside pressure. Number 2, information. The patient must receive all of information regarding his condition and proposed treatment, including alternative treatment, side effects, and the effect of not receiving the treatment. Number 3, competence. The patient must be competent to make an informed decision. So this case study title is Acting Without Prior Consent Due to an Unforeseen Medical Problem. Before I talk about this case and answer the lecture question, you can see the case before. So let's get started.
Acting without prior consent due to an unforeseen medical problem. When Mr. M, a 52-year-old male, was referred to Dr. C, he was in a very serious state. His symptoms included fever, headache, dry tongue, sinus infection, and general septic poisoning. Urinalysis indicated his urine was badly infected. He has stones in his bladder and a large stone in his kidney. Dr. C operated on Mr. M in May, draining his bladder and removing the bladder stones. The patient was subsequently treated with injections and his bladder condition improved. He continued to experience severe pain on his left side and had also developed a hernia. A second operation was performed to alleviate the patient's overall physical condition. Several months after the second operation, Mr. M gave his consent to have surgery to repair his hernia. A day or two after the operation, Mr. M was informed by Dr. C that his testicle had also been removed during the surgery due to potential problems it might have caused. In response, Mr. M said he had not given his consent to the removal of his testicle and had never been informed that it might be necessary. 3 eminent surgeons supported the correctness of Dr. C's procedure. They stated that no surgeon could have anticipated the condition and that further surgery had been necessary.
So the question from my lecture is, should Dr. C have postponed the operation until Mr. M was able to give his consent? And my answer is no. Removal of the testicle was a necessary part of the operation to repair the hernia. The need to remove the testicle could not have reasonably been ascertained before any surgery was undertaken, and consent for further surgery was implied in Mr. M's request to repair the hernia. In the case at bar, the judge found that Dr. M, after making incision in Mr. M's body, discovered condition that neither party had anticipated and that the defendant could not reasonably have foreseen in removing the testicle. He acted in the interest of his patient and for the protection of his health and possibly his life. The removal in that sense was necessary and it would have been unreasonable to postpone the removal to a later date. The judge came to this conclusion despite the absence of express and possibly implied assent of the part of Mr. M. There are situations where it is impossible to obtain the patient consent, but he still treats and everything is done to help him to improve his condition. An example of such a situation is the treatment of a person injured in an accident. Sometimes we are able to obtain the patient's consent to the treatment, but in order to do so, the patient would have to undergo some kind of additional treatment. For instance, it is possible to imagine a scenario where a patient is under anesthesia and we discover that there is an additional problem which was unknown with advance and for which we would need to conduct a different procedure for which the patient had to given his informed consent. This problem can be solved in advance if the patient appoints a legal representative who may decide on his behalf, and or if the patient is aware of such a possibility before the beginning of the treatment and give his informed consent to an optional procedure advance. According to the common point of view, if the patient is not possession of the information in advance and did not give his consent to the matter, the new treatment must not be given and the patient consent must be obtained. However, another approach claims that if the person authorized to grant informed consent to on behalf on the patient is a partner or partner of specially spouse, then there is no need to stop the procedure. This view acceptable in societies where the family plays a great role in the individual life. So that is the case, the question and my answer, and my consideration too for this case. Thank you very much for watch this video. And I want to remind you about this COVID-19 case. Don't forget to wash your hand. Don't forget to use mask everywhere you go. And don't forget to social distancing. Stay at home. So that's it. I wish we always be healthy. Don't forget to like and subscribe. So see you next time. Bye. See you later.